Hello, welcome everybody to today's session on the Q&A with Q&A on the COVID vaccine with Dr. Paul Riley, and we have Deborah joining us doing BSL translation. Thank you, Deborah, for joining as well. And Dave will be facilitating the session with any questions and answers you have. You can add them into the chat and share them via voice call on audio if you are unable to use the chat. We have had some questions come in advance. So Dave, happy to start when you're ready.
Okay, again, thank you very much, Dr. Paul Riley, for attending. We've got 11 pre-submitted questions, and then I'm sure that out of those conversations, a few other bits and pieces will come through. So the first one that we've had is, I've still got antibodies from previously having COVID. Do I need the vaccine?
Yeah, so if I just introduce myself, let everybody know who I am. So I'm Dr. Paul Riley. I'm a GP in Merton, and I work across 2 GP surgeries in the borough, and I've been leading the COVID-19 vaccination campaign in care homes. So I've been delighted to have been asked to come and speak to you all today, and I think this webinar primarily is intended for care home staff, but obviously I think many of the questions that they will have will be relevant to lots of people who have concerns about having the vaccine. So I'm pleased to be able to share the information and knowledge that I have with you to allow you all to make your own informed decisions about whether to have the vaccine or not. I should probably say at this point that I've had the vaccine. My wife, who's pregnant at the moment, she's had the vaccine. Because we believe that it is absolutely safe in the vast majority of people, and it is effective at reducing your risk of catching or suffering from COVID-19. But I totally understand why many people have concerns and questions about it. There's lots of different information that's moving around in various different ways and being shared, and it can be very difficult for you to work out what's truth and what's not truth, and what's best for you. So hopefully as a result of this webinar, you'll feel that you're better informed, and hopefully many more will feel able to take up the vaccine. So the first question that you've asked, Dave, is a fairly common question. I still have antibodies from previously having had COVID. Do I still need the vaccine? Because a lot of people feel that they probably don't. I think first thing to say is that even if you've had COVID once, there are numerous reports that say that some people have unfortunately suffered with COVID twice. I know somebody who has caught COVID again, even though they've had it the first time, and actually the second time they got it was even worse than the first. So from the point of view of protecting yourself from getting COVID again, yes, it's important to have the vaccine to give yourself that extra protection. The next thing to say is that even if you've had COVID once and your body has produced some antibodies, we don't know at this point how long that protection is going to last. And so because we don't know how long it's going to last, we would always recommend you have the vaccine to give you better protection that will last longer. And obviously it's not just about protecting yourself, it's also about protecting everybody around you. So people you love, your family, your colleagues, people that you may care for, and your local community. Because the better protected you are against COVID, the less likely you also are to transmit it to those people.
Fantastic, thank you. The next question is, what is the data on the safety of giving the vaccine to somebody who's having immune suppressant medication?
Yeah, so there is no evidence at all that the vaccine can harm anybody who is immunosuppressed. And that's because the vaccine does not contain any live replicating virus. So the vaccine cannot infect you, whatever is happening to your immune system. And the vaccine is safe in anybody who is taking immunosuppressants. In fact, the fact that you're taking immunosuppressants means that you may be at greater risk of severe illness if you catch COVID-19. So it's probably even more important that you are vaccinated if you are taking immunosuppressants. A very small number of people will be taking very severe immunosuppressants, often if you're taking very strong immunosuppressants, you may be visiting the hospital perhaps every few months to have these immunosuppressants given to you via a drip. And if that's the case for you, then you may just want to discuss the timing of vaccination to make sure that you have the vaccine at a time when your immune system is most strong. And the reason for that is there's a chance that if you're immunosuppressed, your response to the vaccine won't be quite as good and you won't get quite as much protection.
Fantastic. This one's a little bit of a double question now. So is it true that all current vaccines are intended not to prevent transmission of the virus, but to prevent the development of severe symptoms? And do the vaccines prevent transmission at all?
Yeah, so I think the first bit is about symptoms, and then the second bit is about transmission. So the viruses really are designed to do all three things, I would say. One is to stop you catching it. That's the first thing, okay? And the hope is that through vaccination, you'll be less likely to catch COVID-19 at all. And that's what the data shows. The data shows that your risk of catching COVID-19 is reduced substantially if you've had the vaccine. The second thing is, if you do happen to catch it, to reduce the severity of your symptoms. So we know that if you had the vaccine, although you can still catch it, you are less likely to suffer severe illness and less likely to die. And then the third thing is about transmitting the virus. And there is now some good evidence. I think the evidence has been there recently published for the Oxford vaccine, but there's no reason why the Pfizer vaccine should be any different at all. That yes, having the vaccine does reduce your risk of transmitting the virus from yourself to other people.
Fantastic. The next one is very, very common, and I know that we've talked about it on numerous occasions. It's in relation to how quickly the vaccines have been developed and rolled out. And I know that you've given excellent answers before, and if you wouldn't mind replicating that.
Yeah, so this is something that a lot of people are anxious about, actually, and I've spoken to many patients who feel that the vaccine has been produced too quickly, and therefore they think it can't possibly have been analysed appropriately. We can't know whether it's safe or not. We can't know whether it works or not, and they're slightly suspicious of the process. And the first thing I'd say is that no corners have been cut at all in producing the vaccine, and none of the normal steps that go into making and producing and using any vaccine have been skipped. Everything has been done with these vaccines exactly as it has been done for any other vaccine, for any other medicine that you take, for any other medical product that is regulated to be used in the UK by our approval body. They're called the MHRA, Medicines Health and Regulatory Agency, and they have some of the most stringent safety standards and analytical standards in the world. So if they've approved the vaccines, we can be very confident that they are safe and effective. Second thing I'd say is it's not quite true to say that, as some people do, the vaccines have been produced in a year or even under a year, because the science and the technology that's gone behind making the vaccines has been going on for many, many years. It's not like we just started from scratch here. The teams that have produced both the Pfizer vaccine and the Oxford vaccine have been developing the technology for years. What came along then was a target, and they were able to adapt their technology to that target in a very rapid time. And the reason why they were able to do it so quickly is because everybody at every step of the process prioritized getting these vaccines out, number one. Number two, an extraordinarily large amount of money was made available to do this because it was in everybody's interest, not just in the UK, but around the world. So if you imagine when a vaccine is developed, it has to go through many, many different regulatory stages. In normal times, there are many people producing many drugs and many vaccines and many devices. And so you might be, say, 100 in the queue before anybody even looks at your application at every step. Well, in the case of these vaccines, you are always number one in the queue. everybody looked at your application first every step of the way, and that's how they were able to be produced quicker than anything has been before. But the important point is everything was done the same way in terms of standards of safety, in terms of the data that was looked at, and the MHRA have some of the highest and best, strictest standards in the world in terms of approval. So that's how we can be sure it's safe.
And it's fair to say, Dr. Riley, in terms of the vaccines being rolled out, that people were sharing data rather than working in isolation as they have done previously? Yes,
so the process was a lot more transparent than it may otherwise have been, because it was in the global interest, and this isn't a product that's been produced by a private company to make profit. So a lot more data was shared a lot more openly than may otherwise have been the case, and that's another reason why we can be quite sure that this is safe. A few people have previously made comparisons with some rollout of vaccinations and drugs and medicines in which things have gone wrong, and people have not necessarily been alerted to the fact that things have gone wrong because people have been quite secretive about their data. That's not happened here at all. Everyone has been very open and everyone has shared their data widely.
The next couple of questions are in relation to our BAM colleagues or minority groups. So many of staff members are from a BAM background and are very nervous in receiving the vaccine. What advice could you give them?
So I think the first thing I would ask them is why, because it's really important that we understand why this is the case, and different people have different reasons for being nervous or anxious about vaccination, particularly the COVID vaccine. Some of the reasons we may have already covered in this webinar. From a BAME background perspective, what we know for sure is that for some reason, if you're from a BAME background, you are more likely to suffer severe illness if you catch COVID-19, and you're more likely to die if you catch COVID-19. The reasons for that are complicated and not entirely understood, but that's what we know. And therefore, it's even more important that if you're from the BAME community, you do go to get your vaccine, because it's even more important that you are protected. There is no evidence that the vaccine works any differently in the BAME community whatsoever. It's equally as effective, and individuals from the BAME community were included in all the trials that have been conducted so far. And there is also no evidence that the BAME community suffer side effects any differently to any other community. The virus, they say, doesn't discriminate between groups, and the vaccine doesn't discriminate either. The virus infects everybody, and the vaccine protects everybody.
Brilliant. And you've just answered the second question in relation to the BAME community. The next question's around side effects, but it's more around staff claiming that they've had very bad side effects from the vaccine and have had to take time off. How could you reassure other staff in relation to how side effects in terms of risk of not having the vaccine versus actually having the vaccine?
Yeah, so it's certainly true that any vaccination, COVID-19 vaccination included, carries with it a risk of side effects, but the side effects that you experience, if indeed you experience any side effects at all, are mild in comparison with the disease that you can suffer if you were to contract COVID-19. So nobody, as far as I'm aware, has ever suffered any significant long-term side effects as a result of having the vaccine, either in the trials in which it was conducted on over 55,000 people, nor in anybody who's had the vaccine to date, and obviously over 10 million people in the UK have. In contrast with that, we know that many people have suffered severely with the COVID-19 illness. Many people have been admitted to intensive care. Sadly, in the UK, over 100,000 people have died, and many more are suffering with what's called long COVID. So they're out of hospital, but they're still suffering with debilitating effects of the disease, sometimes many, many months after the initial infection. So what you've got to weigh up is what's my risk of side effects and how severe are they from having the vaccine versus what's my risk of becoming severely unwell with COVID. And for the vast majority of people, you're far better off having the vaccine because the side effects in comparison to disease are relatively mild. Side effects, if they occur, what are they? Commonly, you can get discomfort at the site of injection, so that's normally in your upper arm, can be a bit sore, not often at the time, but normally the following day for the next couple of days can feel like you've got a bit of a dead arm. Next day, typically, again, you can feel quite tired. Some people develop a headache. Some people get more generalized muscle aches. Some people get achy joints, and some people get a fever. Now, for vast majority of people, if they get these symptoms, they don't last much more than 10 days. The data suggests they can rarely last up to about a week. My personal experiences, I've never really seen any side effects last longer than a couple of days. And for some people, yes, they are a little bit unpleasant, but again, they're nothing compared to what you can get if you contract COVID-19. And the other thing I suppose to say about side effects is, in some way, although they may be a little bit unpleasant, it's reassuring in that what they tell you is your immune system is responding to the vaccine. You are developing antibodies. You are getting your protection against COVID-19 should COVID-19 come along.
Fantastic. This one's in relation to the vaccine does not provide immunity, which we know that obviously once you've had the 2 doses, it doesn't give 100% effectiveness. And the person goes on to say that it doesn't stop me getting COVID or even from dying, and I have to follow all the government guidance in relation to PPE. Why should I get the vaccine, and what difference does it make?
Yeah, so it's true to say that even if you've had the vaccine, you can still catch COVID-19. And so that's the reason why, even if you've been vaccinated, we still say follow all the government guidance. If you're coming into contact with residents or patients, wear the appropriate PPE. Think about washing your hands, think about wearing the mask, think about staying 2 meters away from everybody, the hands, face, space slogan. All that still applies because, yes, you can still catch it and yes, you can still pass it on. The important thing to remember is it dramatically reduces your risk of catching it. Even if you do catch it, your illness is likely to be far less severe than it otherwise would be, and you are less likely to be able to pass it on. So it's giving you protection. It's not saying you can't possibly get COVID-19, but it's dramatically and significantly reducing your risk of getting it, reducing the risk of severe illness, reducing the risk of passing it on. And all of those are really good reasons why you should have the vaccine.
Fantastic. A similar question, but it's in relation to somebody that hasn't reacted well in the past to vaccines. And what advice would you give them in relation to making the decision to have the COVID vaccine?
Yeah, so all vaccines are different, and they all contain slightly different components. And so because you've reacted adversely to previous vaccines does not necessarily mean you will react adversely to the COVID-19 vaccine, and everything else that we've discussed in this webinar so far still applies for the vast majority of people. The benefit of taking the vaccine outweighs the risk. So first thing I'd say is you don't know how you react until you've had it. And secondly, I'd like to know a little bit more information on exactly how you reacted to a previous vaccine. The one thing that I'd be looking out for is something called anaphylaxis. So anaphylaxis is severe allergy. And if you've had a vaccine before and you've had anaphylaxis, so symptoms would be all over body rash that's typically raised and very itchy, swelling of parts of your body, often your face or your lips or your tongue, shortness of breath and difficulty breathing. If that has happened to you, you'll almost certainly have been to hospital and been given an adrenaline injector pen. Now, the guidance says if that's happened to you and you can identify which vaccine it was that caused it, the guidance suggests that you can actually still safely have either vaccine, the Pfizer or the Oxford. But my personal advice would be, if you've had an anaphylactic reaction to a previous vaccine, it's possible that there's an ingredient called PEG, polyethylene glycol, shortened to PEG, that is in some vaccines. And PEG is in Pfizer, but it's not in Oxford. So my personal advice, if you've had an anaphylactic reaction to a vaccine before, would be to ask your clinician to have the Oxford vaccine rather than the Pfizer one.
Fantastic. The next question is in relation to breastfeeding. So the individual is worried on how the COVID vaccine could affect their baby via breastfeeding.
Okay, so this is a common worry, and I would go back again to the fact that none of the vaccines have a live replicating virus in them, so they cannot infect you. If you are pregnant, they cannot infect your unborn baby, and if you're breastfeeding, they cannot infect your baby through breastfeeding. So there is absolutely no reason to believe that it is not safe when breastfeeding. And if you are breastfeeding, I would recommend you continue to breastfeed and you have vaccination.
In relation to contraceptive, is there any contraindications with the COVID vaccine?
So no contraindications whatsoever. There's no interaction between any contraceptive and the vaccine. The vaccine does not affect your fertility in any way, shape or form, and you should continue to take your normal contraceptive, whatever version of contraceptive or form of contraception you take or use, in just the normal way, and it shouldn't stop you from being vaccinated.
Fantastic. In relation to mental health conditions, particularly around individuals that have depression and a reduced immune system, could the vaccine have an impact on their mental state? So
there's no evidence that vaccination negatively impacts on anybody's mental health at all. There are studies and there is some evidence that certain mental illnesses, depression or severe depression in particular, there's a suggestion that it can impact your immune response, but there's no evidence that it impacts your immune response so significantly that it should affect the way the vaccine works, or that it should affect the strength of your response or the protection that you get. So irrespective of whether you have mental illness or not, I would strongly recommend you do have the vaccine.
Fantastic. The last one before we move on to Lisa, and then if you don't mind, Dr. Riley, we'll come back and open the phone lines if that's okay. The last one's around fertility. So we get a lot of questions around fertility. I was wondering if you could comment on that.
Yeah, so a lot of people are concerned about fertility. I'm not quite sure where the suggestion that it can impact on fertility arose, but there's no reason whatsoever to believe that it affects fertility, and there's no evidence that it affects fertility. And the vaccine doesn't impact on the way reproductive system or reproductive organs work in any way. So some people are worried, in particular if they are visiting a fertility clinic, if they're struggling to conceive, that vaccination will somehow reduce their chances. That's not the case, and there's no evidence that that is the case, and there's no reason to believe it should be the case. So whatever your fertility status is, whatever assistance you're receiving, you ought to be able to have the vaccine, and it shouldn't affect that process in any way at all.
Fantastic, thank you. Jiggy, if I hand back over to you to introduce Lisa.
Thanks, Dave. And thank you, Paul, for sharing the information. I think it's really, really important so that everyone can have that evidence-based information to make their decision on whether they have the COVID vaccine. And I want to welcome Lisa. Hello,
Hi.
Lisa, thank you for joining us today.
Hi everyone, sorry I was late.
Hi, Lisa.
Hi, nice to meet you all.
And we've got Deborah here joining, who's signing along with us as well. And let me know, Deborah, if we're going too fast. Okay, so Lisa, to start, I would just want to ask you if you would be able to tell me a little bit about yourself and what you do, your age, and how you got COVID and when you got COVID.
Yeah, I'm 44. I work full time and have a family. There's 6 of us all together, but there's 4 of us that live in this house. So we're quite an active family. I work for our family business in DIY. Sorry, I'm just going to shut my laptop and repeating back at myself, sorry. So yeah, I work in the DIY sector, which is really busy. It has been through COVID, so very active at work as well. And I think I got COVID through probably school or something like that. I'm not 100% how I got it, but I do think I've had it twice, and it's affected me quite severely.
Did you say, so you just mentioned you've had it twice. Did you get it early on during the year last year as well?
Yeah, I contracted it. I'd met with somebody on an airport and I'd been sat chatting with them, and they had a really severe cough. That was back in end of January, and they just returned from China. So I know that time, and I was quite ill for a couple of weeks.
Okay.
And then it took me just to recover probably a few months, you know, feeling tired, going home, falling asleep after work, feeling terrible when I woke up in the morning, but I just got on with my days at that point. But yeah, but I still had chest pains up till November before I contracted COVID and got a test this time.
So you've got it again for the second time, and
yeah,
and that was back in November. And what were the effects the second time round?
the second time round, I wasn't, to start off with, I wasn't severely ill. I had a cough, I was breathless. I knew it was COVID from the symptoms, so I got a test. Basically, I was pottering around the house for a couple of weeks, thinking, well, I'll be back to work in another week, doing a bit of kitchen cleaning, sitting down in between, not feeling great, headaches, and just dosing myself up really and just getting through the day. It wasn't until week 3 that I started to get severely ill with respiratory symptoms. It triggered off sort of underlying asthma in me, and I've just got worse progressively after that for quite a while. Probably at least I was a month where I couldn't really do anything. I couldn't even walk to the dishwasher without being completely out of breath. I could get up a little bit, sit back down, even get in a shower. It was just horrendous. And that continued for really about a month or so before I could start moving around a little bit more by bit after bit, really.
Yeah. And I know you weren't hospitalised, but obviously the symptoms are ongoing and they're continuing.
I went twice to hospital. I did go twice. The NHS were brilliant. They checked me over. They checked my respiratory. They did all the tests, make sure that there's no blood clots or anything. I've been well looked after. I've been in twice because my doctor wanted to do more tests. They sent me home, told me to rest. And to be honest, I've been resting really in comparison to my normal life. I'm probably just about getting to about a third of what I normally do daily, sort of building it up. But I get to a certain time of day and I get headaches and I'm still quite poorly with it really. And I do get good days, I get bad days. I don't know what's going to come next. It could be a phone call that triggers me, or it could be going for a walk. Some days I can go for a walk, I'm fine. Some days I'm not. Some days I have a stressful phone call with work, which I'm doing probably about an hour or 2 a day now at work from home. And I just don't know what's going to cause it at any time, really.
I know, Lisa, you mentioned you've got a lovely family with you as well. Have you been, I suppose it's probably been a bit difficult to keep up with your normal routine. So how have you managed with family?
It's been difficult. I I do a lot of the running around. I work sort of 30, 40 miles away from home. So normally I'm up and out the house at 7 in the morning, and then I get back for 4 to pick my little boy up from school. So normally my day starts at 7 and it finishes probably about 9 o'clock at night. So now I'm sort of getting up, potter in the morning, try to just keep up with bits of washing. My husband drops my little boy off at work now. Sorry, at school, and then he's trying to help with bits, but he's actually, because it's a family business, he's working more, you see, sort of trying to make up for me a little bit. So I'm just, I don't know, it's just a potter. And I was saying, I think I told you before, what seems to happen is it takes me twice as long to do everything because I forget things. So my step count is probably much better than it should be for the activities I'm doing, because I get there and my brain fog, it's just horrendous, and I think I can't remember what I'm doing. So, and then I start again. So I just find that I'm constantly backtracking and going back to where I was before, and that's quite difficult.
And were you generally healthy beforehand?
Yeah, when I was younger, I used to do a lot of running and things. I haven't in recent years. I've got a dog. We go on long walks every weekend. We take the dog out. We take all the kids with us. We have a 4-year-old running back and forth and the dog running back and forth. We're a very active family. There's never a weekend where in normal times we stay in, really. We're always out or doing something. So yeah, it's quite different. And we're always out every night walking the dog and things like that. So everything's sort of, we had dog walkers and everything to get us through it to begin with. But yeah.
And if you were offered the vaccine before you got COVID, would you have had it?
Yes. I would have had it. I'm a believer in vaccines. I just think that there's a lot of good and a lot of, I have friends that work on vaccines at Manchester University. So I do believe that there's a lot of work goes into it, and I do believe it's the right thing to do. But I actually, for one, something I haven't mentioned is I thought I was going to get COVID, and for 2 weeks I was going to be ill and I was going to be back at work. Now that was 1st of March I got my test, and I'm now here, and it's what are we, sort of middle of February nearly, and I'm nowhere near going back to work. So it's affected me that badly.
Yeah. And I think that's really important to share with everybody as well, because sorry, I didn't ask if you're okay to share your age with everybody.
I did, I'm 44, yeah.
Because, you were young, you're relatively healthy, and you've got a family, and you were doing daily activities as normal prior to this. You never know how badly you're going to be affected. So kind of the side effects of having the vaccine are not comparable to actually having the COVID itself, because you never know how you're going to be affected. I know some people get some people are asymptomatic and some people have mild symptoms, but some people are very badly affected or even have long-term effects like you have experienced.
Sorry to jump in, but it's not just me. Even just recently, I've met 2 other women very similar age to me in my area that are friends of friends, where my friends have seen something because I've spoken to the press about long COVID, and they've got in touch, and the symptoms are very similar to mine. Some of them are a little bit worse than me. They're not getting out as much as I'm managing to, but there's a lot of young women and men out there really going through this in the same way, and it's very difficult for people because you do think you're either going to get it and be in hospital and it's going to be really dramatic, but it's not always really dramatic. It sort of has a real toll on your life in general.
Yeah, completely, in every way, because financially, emotionally, spiritually, every way it impacts your life, doesn't it?
Yeah, mentally it is quite difficult at times because you think, I'm not a skiver. I've always been a girl that goes out to work. I make my kids get up if they've got colds. So they'd have to be on death's door before you have a day off school. So we're sort of a family like that. So for me to get up in the morning, potter a bit and sit back down, and when I'm sat down I can feel really normal, but it's what comes after that when I stand up and I get breathless and things like that. So I think I'll sit there and mentally think, oh God, I feel like I'm skiving. So that's quite difficult because I want to be active and at work. So it's quite a struggle when you're so active like me to actually sit there and do nothing, because like my whole personality is, right, come on, Lisa, let's do this and do that, and do probably 5 times what a lot of people do, to be honest. So yeah.
And I do hope that your recovery is quick, and I'm so sorry to hear as well that it's still ongoing. But
yeah,
I
am getting some help though. I've got some physio coming as well. So yeah.
And you're part of a lovely support network as well, aren't you?
Yeah, I am. Yeah, they've been great. It's nice to hear that you're not the only person going through it. So.
And thank you, Lisa.
No, thank you.
If anybody has any questions, please share. And thank you, Lisa, for sharing your story, because I know it can be hard to share with everybody such a difficult, I suppose, in some ways traumatic situation that you're going through. Yeah, thank you.
Thank you.
Yeah,
thank you, Lisa. Dr. Riley, just on Lisa's story, is this something that you're seeing on a regular basis in practice?
Sadly, yes. I mean, I think you're a couple of really relevant points, Lisa. Thanks so much for coming and sharing your story, because it's so important that people hear what the effects of COVID-19 can be firsthand. It's very easy, if you don't meet people who have experienced it or are experiencing it, to just think it's something that won't affect you but will affect somebody else. But when you see somebody come and present their story in the way you do, it just brings it to life and makes it seem very real, as we know it is, because we do see, sadly, many patients suffering with the so-called long COVID, to the extent that Lisa will be well aware, but special clinics are being set up in the hospital, and we're rapidly understanding more and more about features of long COVID, because so many people sadly are suffering for many months in the same way that you are, and there's a huge demand for a specialist service so that we can learn more about it and try and understand why these symptoms occur and work out how we can help support people with long COVID as best as we possibly can. But also, you illustrated the fact that you can catch COVID twice. I think you said this was the second time that you caught it, and also the fact that you don't necessarily need to be severely ill in intensive care to suffer. And people might not know. One of the frustrating things I imagine for you, Lisa, is to look at you. You wouldn't guess, just seeing you on the Teams call, you wouldn't guess there was anything wrong. And if you saw you in the street, you wouldn't guess there was anything wrong. But you know how hard it is for you just to do normal activities of daily life at the moment. And then the other thing that's probably, I guess, anxiety provoking is this is a new illness, relatively new illness, and actually, we don't quite know how long your symptoms are going to last and what the trajectory is going to be over the coming weeks and months. Obviously, we wish you all the best, Lisa, and I hope you continue to make progress and recover fully in time. But I know that for many people who have this, part of the anxiety is, well, nobody really actually quite knows what's going on, and we're not sure how long it's going to last. And it's difficult when there are these sort of question marks over your condition. And so the impact on your mental health is presumably just as great as it is on your physical health.
Yeah, it can be. It's frustrating sometimes when everyone says, "Oh, you look really well," and I'm thinking, "Yeah, I really wish I was very well." but it's also getting that balance as well between being ill and having a conversation with people and not always talking about it, because it's always there. It's not something that goes away. So it's quite difficult sort of mentally to sort of see yourself as a normal active person again and just go out and do the things you normally do.
Yeah, which I'm sure you will be, in due course. And I think actually it's fantastic that you're getting together with other people, supporting each other and supporting yourselves, and also talking about it in this way to other people, just to spread the message and make people aware. It's hugely beneficial. So thank you so much, Lisa.
No, thank you. Take care.
Before we ask some other questions, I think it'd be good if we just give people opportunities to either ask questions to Dr. Paul Riley or to Lisa. If you'd like to either put your hands up or take yourselves off mute and ask a question at this time, you're more than welcome to. We've got a very quiet bunch today. We've got a very quiet bunch.
Hi, Dave. There's some questions that have come through in the chat. If you are allergic to penicillin, can you have the vaccine?
So, yeah, you definitely can. Allergy to penicillin is not a contraindication to have the vaccine. There is no penicillin in the vaccine. I would extend my answer a little bit to say that, again, I know I talked previously about anaphylaxis. If you have had anaphylaxis, so that's severe allergic reaction where you get a rash all over your body that's a raised rash, an itchy rash, causes your face to swell, your lips to swell, your tongue to swell, your throat to close, and you have difficulty breathing, and you normally would then go to hospital, be given adrenaline and carry an adrenaline pen with you in case it happens again. If you've had anaphylaxis to more than one drug, then it's important that you let your clinician know, and you should not have the Pfizer vaccine, but you should have the Oxford vaccine. Again, because it may be that you have an allergy to this PEG, polyethylene glycol, which is in Pfizer. But otherwise, if that's not the case, if you've never had anaphylaxis, or if you only have anaphylaxis to one drug, then you can have either vaccine. But allergy to penicillin, absolutely, the vaccine's safe, and I advise you to have it.
Fantastic. Any more questions in the chat?
Yeah,
There is.
I've got a quick question about the vaccine. As you know, that we have got quite a good support group with COVID-19 on Facebook, and I do see a lot of people posting questions and worrying about the vaccine for themselves, as they have had all these problems, respiratory headaches, and they've had COVID. So there's a lot of people really thinking, well, should I be doing it? Is it going to make me worse? So what would your answer be to these people?
So there's no virus in the vaccine. There is certainly no COVID-19 in the vaccine. The vaccine cannot infect you with anything. And so there's no reason why, if you've had the vaccine, you should get symptoms of COVID-19. However, you may get symptoms that are common to having any vaccination, some of which we covered earlier, though I think you may not have been at that point, Lisa. So the common symptoms that you can get with any vaccine, and which are also seen with COVID-19 vaccination, are sore arm or some just discomfort at the site of the injection. The next day you may feel tired and fatigued. Some people are reporting headaches, sometimes muscle aches over your body, sometimes aching joints, and some people after vaccination can get a mild fever. For the vast majority of people, if they get these symptoms, they don't last for any longer than a couple of days, although it's said in the literature that they can last for up to a week. But none of the symptoms that you get or side effects that you can get from vaccination are as severe or last as long as the symptoms that you can get with COVID-19 infection itself.
I agree. I know a few people that have had 48 hours of just feeling a bit dreary, a few aches and pains and things, but nothing in comparison to sort of having 3 months of COVID symptoms. So yeah.
Exactly.
Yeah. Thank you.
Thank you, Paul. There's another question that's in there is, well, actually, I suppose we all know there's a lot of misinformation being shared on social media and WhatsApp. How can I know what is right and wrong?
It's really difficult, to be honest, for you to know what's right and wrong, especially on social media. So I would go to trusted resources. So the NHS website is excellent, and perhaps we can, I don't know if we can share links to the website either now in this webinar or subsequently, if we can send that information out. Government, gov.uk, or it's gov.uk website, talking about COVID-19 and information that you obtain from government websites is a trusted source of information. Your own clinicians, your own doctors, GPs, your local pharmacy, health approved and regulated healthcare professionals throughout the UK can give you information. I would try to steer clear of social media at all, to be honest, because I think through these websites or talking to recognised, regulated, licensed healthcare professionals, your own GP surgery, you'll be able to get all the information there, to be honest, that you need. Local councils often can also point you in the direction of trusted sources and may be able to give you information themselves. So there are many trusted places that you can go to that I've mentioned for good information. I would be very suspicious of any information that's being circulated on social media, but by anybody really. Some of these organisations are active on social media, but it can be difficult for you to tell on social media, is this actually coming from the NHS, or is this somebody who's just set themselves up to look like the NHS? Because sadly, and quite unbelievably, some people are intentionally spreading misinformation about the vaccines, and they can be very clever about the way they do it. So if you're in any doubt whatsoever, speak to your local GP practice, speak to your clinician there, speak to somebody in the pharmacy, go to the NHS website directly, or gov.uk websites for information.
And just to pick up on that, in terms of scams that we've seen within the NHS, in terms of people trying to be charged for COVID vaccines, you would never, ever be charged for a vaccine. So if anybody is contacted in relation to paying for a vaccine, then obviously it's to recognise that not to give your bank details and to report it to the necessary authorities.
Thanks, Dave. That's really important, because there's a lot of scam messages, emails, texts, people coming to the door, phone calls. It's coming from every direction right now. So to make people aware that, you know, they need to fact check before they do it, and the NHS will never charge you, and they'll contact you by official means from your GP's practice or your clinicians. Another question that I have that's come in is, if I have had the vaccine, will this prevent me from carrying on or passing COVID-19 to others?
So, good question. So there is evidence and data to support the fact that if you have been vaccinated, you are less likely to pass COVID-19 on to others, but it doesn't completely prevent you from either catching COVID-19 or from transmitting it to other people. And that's why even if you've been vaccinated, it's really important to still follow all the normal precautions that everybody is following at this time, to wash your hands regularly, to wear your face masks, and to keep your distance 2 meters from everybody else. Because although you're less likely to catch it and less likely to transmit it, you can still do both even after vaccination.
Thank you, Paul. On the news, it has been publicised that the Oxford vaccine does not work as effectively with the South African variant. Is this true?
So that is a complex question to answer, and certainly studies are still ongoing. What we know for sure is that the Oxford vaccine offers you very good protection against the most common variant that you find in the UK, and the South African variant is not the most common. It's affected by far and away a minority of people thus far in the UK. They have done some studies that have shown that it's not particularly effective at preventing mild disease, and they think they termed it mild and moderate COVID-19, but there is still reason to believe that it will be effective at preventing or reducing your risk of suffering from severe COVID-19 disease, or from needing to go into intensive care, or from dying from COVID-19. So all the scientists at the moment believe it offers some protection, and therefore it's still really important that if you are offered the Oxford vaccine, you do take it up at this time.
Thank you, Paul. And another question is, Dave, if you can see any.
One of our hesitant groups that we've seen over our last few weeks is for younger individuals and younger adults. Particularly what we get told is that I've always had a good immune system, I'm fit and healthy, why should I take the vaccine? I think if you can spend a little bit of time talking that through, that'd be absolutely spectacular.
Yeah, no problem. So the sad thing about COVID-19 is that it can affect anybody of any age, whether you have pre-existing health conditions or not, and you have no way of knowing how it is going to affect you. So although it is true that if you are older and if you have multiple health conditions, it is more likely that you will suffer with severe illness and pass away with COVID-19. Tragically, we've seen many young people contracting COVID-19, suffering severe complications, needing admission to intensive care, sometimes passing away, or suffering with this long COVID, so symptoms of COVID-19 for many months after infection that really have a debilitating effect on their life and ability to carry out normal activities of daily living. And Lisa has come today and describe a lot better than I can firsthand the symptoms that Lisa, don't mind me repeating your age again, at 44, previously fit, healthy, very active, has really been significantly impacted. So even if you think I'm young, I'm fit, I'm healthy, I don't get sick, sadly, young, fit, healthy people do get sick with COVID-19, and to not have the vaccine is to roll the dice. And given that the vaccine's available, doesn't make sense not to take it up, because it's safe and we know that it's effective. The other thing to say is that vaccination is not just about protecting yourself, it's about protecting those people around you. So you may be young, fit and healthy, but almost certainly you have a family who are older, who may have medical problems, parents, grandparents, or you have work colleagues, or you have friends who you come into contact with. And even if you don't suffer with COVID-19, you can transmit it to them, and they may suffer severe illness, long COVID, or pass away. And the last thing you want to do is feel that actually you had a part to play in that, and you didn't do everything that you could do to protect your loved ones, your family, your friends, your colleagues and your community. So those are two really good reasons, I think, why young, fit and healthy people should take up the vaccine.
Absolutely. And I think given the number of deaths that we've seen from COVID, any death from COVID is tragic, but I think it's also very important to highlight the number of deaths we've seen. So flu vaccines, we have a number of deaths every year, but I think if you could just spend a little bit of time explaining how many deaths we've had in comparison to a normal flu season.
Yeah, so I think the figures for the UK, I won't be able to quote the figures of deaths by flu every year, but what I would say is that actually flu kills a lot more people than most members of the public realise each year, and each year we spend time trying to explain that flu is a deadly virus for many people, and encouraging people to take up the flu vaccine. But certainly the numbers that have died from COVID far exceed any normal flu season. And obviously we know in the UK is now over 100,000, I think over 110,000 deaths in under a year, which is extraordinary and tragic. And then the other point I'd make again is it's not just about the deaths, because some people say, well, most of these people were frail and elderly, and actually if it wasn't COVID-19, perhaps they would have passed away from something else anyway. So number one, every death is a tragedy, but two, it's not just about deaths, because there are many people suffering like Lisa with long COVID symptoms, and they're not a statistic on the page, but they can't live their normal life, and they've spent months not being able to live their normal life. And for anybody who's been admitted to intensive care, it's an incredibly harrowing experience. You wouldn't wish it upon anybody, and we've met some other patients in forums who've recounted their stories, and months down the line, they're still suffering from physical problems and mental problems as a result of being so severely unwell. So the toll from COVID-19 is significant, and even when the virus has gone, eventually many people will still be suffering.
I know that we are coming up to the end of the session, but there's 2 questions in the chat and then we'll open the phone lines again. Does the vaccine contain any animal products, gelatin, and is it suitable for vegetarians, etc.? Yeah,
so there are no animal products in the vaccines, absolutely suitable for vegetarians. And I know a variety of religious groups for very good reasons have been concerned about what's contained in the vaccines, but that there's no reason why anybody from any religious group should not have the vaccine. There are no religious contraindications to vaccination.
And the last question is around RNA affecting DNA.
Yeah, so the vaccines contain a molecule called RNA, which is similar to but different from DNA, and RNA does not affect DNA in any way, shape or form. The vaccines do not affect your DNA. They don't interact with the DNA whatsoever. There's a little bit of confusion because obviously RNA and DNA sound similar. They are similar molecules, but they are completely different. And RNA does not affect DNA at all.
Fantastic. Have we got any last questions before we start to wrap the session up?
I just had one. It's not so much a question. I mentioned earlier that people are ill for about 48 hours sometimes, but the majority of people that I know that have had it haven't been ill for 48 hours. There's a lot of people that, in numbers, I don't know an awful lot of people, but it outweighs the amount of people outweigh the people that have struggled for 48 hours that haven't had any symptoms whatsoever. Do you have any statistics on that yet?
Yeah, so I won't be able to quote you the exact statistics. What I would say is most people, so more than 50% of people, will have very mild symptoms. So that would be slight discomfort at the site of injection, not feeling quite 100% the next day. Most people will have symptoms to that extent, but the number of people who have side effects that really make them feel unwell for 48 hours to the extent that they may consider working, that's a minority. That's certainly a minority.
Yeah. Thank you.
And the last question we've just had posted is, can I have the vaccine just after having a tooth removed?
Yes, so certainly you can, even if you're taking medication, painkillers or antibiotics. The vaccine doesn't interfere with them. They don't interfere with the vaccine. Yes, you can.
And can you have the vaccine if you've recently had allergies to nuts or fish?
Yes, you definitely can have the vaccine with allergies to nut or fish. Even if you have anaphylaxis to nut or fish, you can still have the vaccine. The only reason from an allergy perspective why you can't have the vaccine is if you have anaphylaxis, so severe allergy to more than one drug, or if you have anaphylaxis and you don't know what has caused it, or if you have a severe allergy to the vaccine itself or any of components of the vaccine.
Fantastic. Thank you very much, Dr. Riley. Obviously, we need to draw the session to a close, and I'd like to personally thank Dr. Paul Riley, Lisa Royle for attending, and obviously Deborah for signing. Jiggy, is there any final words before we close?
Thank you, Dave, for facilitating as well. I think this has been a brilliant session to give everybody the information they need to make an informed decision. And I just want to remind everybody to continue all the hard work that they're doing within their work, and social distancing, on public transport within their work, and remember to also continue to wear that PPE even once you have had that vaccine. So double mask, triple mask if you need to. Wear those gloves when you're doing specific procedures, and continue to be as safe as possible to protect yourself and all those around you. Thank you. Thanks everybody for joining today.
Thanks everybody.
Deb, thank you so much for signing. It's fantastic, fantastic job. Thank you. Thanks, Lisa, and I hope you're feeling better day by day.
Thank you.